All right. Well, it looks like everyone's filtered in now, and I'm sure we'll have some people joining. Just to get us started, um, first of all, welcome to today's webinar. We're here to talk about COVID-19 vaccination, especially as it relates to pregnancy, breastfeeding, fertility, and children's health. We're going to cover 4 key areas. First, the safest decisions to make during pregnancy, common questions for breastfeeding parents, fertility concerns related to vaccination, and then, of course, protecting the unvaccinated, what we should know about children's health, which is, of course, especially important as children start returning to school. So thank you all for joining us today, and thank you to all of you who have already submitted your questions in advance. A couple of housekeeping items I wanted to make sure that we talked about first. First of all, we encourage your questions, and that is why we're here today, to create that safe space for your concerns. But please also keep in mind, this isn't a debate, and we really ask that you be respectful throughout and open to the points of view that our experts are here to share today. Please use the chat function in Zoom to share any questions that you have. And I would note that we're not able to address health questions that are very specific to you, but that said, we're going to answer as many questions as we can at the end of the panel discussion today. If your question isn't answered today, we invite you to share your question with us at Sentara-events@sentara.com, which we will repeat at the end of this webinar. And keep in mind, if you have to leave early, this webinar is being recorded. So anyone who's registered is going to have the link to the recording in their inbox. So finally, I'm happy to introduce our panel today. We have Dr. Adele Moser with Sentara Obstetrics and Gynecology Specialists, Dr. Leah Porsche, Maternal Fetal Medicine at EVMS, and Dr. Gwen Williams, Sentara Hospital Medicine Physicians. Each of these physicians and speakers today has dedicated their careers to the health of women or children, and they're ready to answer your questions today about COVID-19 vaccination. So on that note, I will go ahead and hand it over to you, Dr. Moser, to get us started.
Thank you so much, April. Really appreciate it. All right, and so with that brief introduction, if we can circle back, and if Dr. Porsche and Dr. Williams, if you'll say a little bit of where you did your training, what your background is, and maybe 1 or 2 personal information tidbits that you want to share to the meeting today.
Yeah, sure. Hi, everyone. My name is Dr. Gwen Williams. I'm a hospitalist at Sentara Careplex Hospital. For those of you who don't know what a hospitalist is I take care of all adult patients who come to the hospital. So patients who come in through the emergency room and they need to be admitted. It's my team and my specialty who takes care of them, whether they're, admitted for chest pain, a stroke, or they're admitted to the ICU. So it was very much the hospital medicine teams, along with ICU and infectious disease, among other specialties, who were taking care of COVID patients. I actually took care of COVID patients until I was 38 weeks pregnant a few weeks ago. So I have a lot of experience with very, very sick COVID patients in the hospital. That is our area of expertise right now. Just understanding how devastating the disease could be to somebody who is not pregnant. And I feel like it is our moral duty to get it out there to women who are pregnant or wanting to become pregnant, or who just have small children at home, to know what it is that we're up against and the reality of that. So I had a baby 2 weeks ago, so that's what you will hear in the background. I apologize if she starts crying. And I'm breastfeeding right now as well, and dealing with the challenges of that. So I'm just very, very happy to be here, with all of you, and just embark on this discussion together. Oh, and I was vaccinated in December when I was 5 weeks pregnant, and we knew a lot less then than we know now about what's going on. So I have a story about that when we get to it.
Very good, thank you. And Dr. Porsche?
Yes, hi, my name is Dr. Leah Porsche. I am an assistant professor in the Division of Maternal Fetal Medicine at Eastern Virginia Medical School. Maternal fetal medicine is a specialty of obstetrics and gynecology where we deal with high-risk pregnancies, so pregnancies that are complicated for one reason or another. I did my undergraduate education at Duke University in Durham, North Carolina. I did my medical school at UNC Chapel Hill in Chapel Hill, North Carolina. And then I did my residency and fellowship here in Norfolk at Eastern Virginia Medical School. I have 3 children of my own, 6 years old, 3 years old, and almost 10 months old. I got vaccinated when I was breastfeeding, just because of the timing of things. That's when it became available to me. So I was excited to be able to offer that immunity, at least for breastfeeding. And I'm just excited to talk to you guys from firsthand experience, from the research that we've been able to review, and what we're seeing happening on the ground, firsthand experience, to answer your questions.
All right, and that brings myself back to me. And my name's Adele Moser. I went to undergrad at UNC Chapel Hill, did medical school at Brody and Eastern Carolina University at Greenville, North Carolina, and did my residency training in Wilmington. So I've just circled the state a little bit. And I now practice as a general OBGYN in Elizabeth City, North Carolina, which is a small town in the Virginia-North Carolina border, beautiful town you pass through when going to the Outer Banks. And so I do not have any children of my own. I got vaccinated in December, right before Christmas. And I do have a little puppy dog, which you also might hear in the background, but hopefully not. And with that, I am eager to get the conversation started. I wanted to take this opportunity, though, to really focus in on just the understanding that all of us truly do want a healthy mom and a healthy baby. That's always my top 2 priorities when I'm dealing with any patient that is wanting to conceive, conceived. My spiel on labor and delivery to this day has not changed. You could play a tape recorder. I want a healthy mom and a healthy baby, and the rest is the cherry on top. So that's definitely always and forever will be my goal today. We really want to focus on what the evidence is, what evidence still is yet to come, the changing evolution of science, what we do know in science, what is there still left to learn, and want to really address any concerns, fears, alleviate some if we can, and acknowledge when we don't know the answer as well. I do want to make sure we will address as many of the questions that were already pre-submitted, and then afterwards we'll address the questions as they come in the chat box. Some of the more personal questions may need to be diverted to a more individualized either conversation with your employer or your personal healthcare provider. And with that, let's start with the first question I have. So the question to the group is, does getting the COVID vaccine while pregnant produce antibodies to the baby as well? So I'm going to start, and then Dr. Porsche, you can add in, as I'm sure you very well can elaborate. So yes, indeed. Certain antibodies are able to be passed along. So antibodies are kind of like one of the many defense mechanisms or tools in the toolbox that your body has to defend against a virus or a bacteria. The antibodies that go across the placenta is the IgG, or the G for go, and it goes across the placenta. The placenta probably has the highest transmission of antibodies around the 27 to 36 week. And if you're pregnant or have been pregnant in the past, at least within the last 10 years or so, we really do advocate for the Tdap, if you've ever heard of the whooping cough vaccine, around that same time frame. And that's because the most antibodies, like to help protect the baby, are passed along that time frame. That being said, especially given the different variants that are emerging, as well as, of course, the Delta variant, I don't think the benefit weighs on the waiting till that time frame to get vaccinated, but it is probably the biggest transfer of antibodies. And we'll save the antibody discussion about breastfeeding for a subsequent visit or subsequent question. What would you add, do you think, Dr. Porsche, to that question?
Yeah, so absolutely, that IgG antibody that your body produces in response to the COVID vaccination does cross the placenta. They have done studies where after moms have been vaccinated during pregnancy, they can find that antibody in the cord blood. So they have evidence that it is circulating within the baby. And that same IgG that protects you who got vaccinated protects the baby as well. Now, it's not completely clear how long that antibody lasts in the baby, but we do know that the baby is protected while that is circulating. Because the vaccine, has come out in the last, year or so, we're still trying to figure out how long the immunity lasts in us. But we know that that protection is really important for pregnant moms. We also know that it's very important for young children. We used to think that, kids couldn't really be affected by COVID. And now we're seeing with these new variants, a lot more children are being affected and being admitted to the hospital and being admitted to the ICU. And so that protection that's passive, that you're able to give to your baby is really important.
Absolutely. And I do have at least short-term data with some at least presence or absence of IgG and IgA in breast milk. So let me skip a couple questions down and go to what current research is saying in regards to protection from COVID-19 in regards to breast milk fed babies. If you can tell us more about that, Dr. Porsche.
Yeah, so they've done studies looking at and analyzing breast milk for certain antibodies. Like we said, there's multiple different kinds of antibodies. So IgG is one of the main ones. That's a long-term immunity in your blood. IgA is one of the ones that deals with mucosal immunity. So the things that come in contact to your mouth, your nose, your eyes, it helps those cells to recognize pathogens and kind of start that attack to defend your body. They looked a lot at the IgA and the presence of IgA in the breast milk after vaccination. And they said that, yes, there is IgA that is provided in the breast milk to breastfed babies. Now, there's known benefits for breastfeeding with regards to other infections. When you get colds or the baby is sick and then mom is exposed to to that germ, you make antibodies and kind of it's this fantastically synergistic relationship between you and your baby whenever you're breastfeeding. The same thing can happen with the vaccination where you get those antibodies passed into the baby and may also increase their immunity or their ability to defend in that capacity as well.
Excellent. Thank you, Dr. Porsche. And what I wanted to share, and this is low numbers, but Israel had out of the gate, a robust vaccination effort. So some of the more available data has been from Israel. Out of 84 women that had all gotten vaccinated, they did 504 breast milk samples. And after 1 week after the second vaccine, 92% of the babies tested positive for IgG, 86% for IgA. And then after after 6 weeks, the IgG actually increased to 97%, but the IgA decreased to 65%. Because like you said, Dr. Porsche, it's more of a short-term, shorter lasting antibody response, but a maybe better first line response because it may have the opportunity to prevent the actual infection taking hold of the body because it defends at more the mucosal surface as a result. And I don't mean to be excluding you, Dr. Williams. So if at any point I do not mean to, please jump in.
No, I think that's fine. I think one thing just to add, because you all are the experts when it comes to, especially maternal fetal medicine and pregnancy and breastfeeding. I think it's important for our audience to understand that when I was pregnant, when you were away, if you were pregnant now, if you're planning on becoming pregnant, if you're postpartum and you're breastfeeding, when you get the vaccine does not go into the baby. That's not what happens. It's very important because this is a misconception that I'm seeing all over, unfortunately, social media is where people are getting their information. That is not a good source of information. I'm going to tell you right now, I'm not going to sugarcoat it. But when I got the vaccine did not go from me through my placenta into my baby. What happened was I had a humoral response. I had an immune response that created antibodies. My good antibodies is what is allowed to go through the placenta, just like other antibodies I have to other illnesses, that are out there that I get vaccinated for. So for example, they had to check my chickenpox titers, right? They had to check my tetanus titers. They had to check all of these things to make sure I had a good level to protect baby as well. And I think that's really, really, really important that we understand that when I'm getting a vaccine, it's not going through my bloodstream, the actual vaccine. It is a messenger RNA vaccine that creates spike proteins on the cell. These are proteins that the body recognizes, so that if I ever came in contact with COVID, my body would recognize that, you shouldn't be here, and it'll attack it. And that's how we help protect baby via mom as the vessel, right, of protection, because that's what moms are. Moms are vessels of protection for their child. And the same thing with breastfeeding. If you're breastfeeding and you get the vaccine is not going from your arm into your bloodstream, into your breast milk and going into baby. So, and I think that's a misconception and a fear that people have, like, my baby's going to have a reaction. No. You may have a little redness, you may get a fever. I got a fever after my second dose, and about like 12 to 24 hours, just like with any vaccine that I've gotten, even my Tdap that I got later in my pregnancy, as recommended by my OB and ACOG and all of the professional organizations. The next day, I was like feverish and I didn't feel good and my body aches. And this was a routine vaccine I've gotten in the past. And I think it's important to normalize that's a normal response my body was having.
Yes, I think that's such a great point, that the placenta, it's a filter. It's not that everything that goes into your body goes across the placenta. The placenta is very smart and it keeps a lot of things out. And I think that's fantastic that you explained that and made it so vivid, because that's so important for people to understand.
And it's also true that the mRNA is one of the quickest to be degraded substances.
Yes,
and
rapidly.
Indeed. So there's no chance of getting the virus. These are dead vaccines. There's no chance of ever being incorporated into your own cells. It's degraded too quickly for that ever to be a concern. And I'm going to break my rule and actually choose to answer, because it's just flowing. A couple questions in the chat box are related to long-term risk, and also in regards to, well, outside of Tdap and flu, those are the only vaccines that women are standardly getting. What makes this vaccine safe and okay, where you wouldn't, say, get chickenpox or MMR vaccine in pregnancy?
Yeah, so there are some vaccines that are what we call live attenuated, where there is, some viral particle, and there's some that are that do not have any kind of what we call attenuated or deactivated germs in them. And so those are the ones that are not live attenuated are ones that are okay to get during pregnancy. The ones that are, you have to wait until after pregnancy or when you're not pregnant. So with the mRNA vaccine, since there's no virus at all involved in this. And so we know that it's not going to make you sick. It's not going to make the baby sick. So that's the difference. There's different classes of vaccinations. And this falls into that class of vaccination that is safe during pregnancy.
And what about the long-term side effects?
So we know that there are short-term side effects, like you guys discussed: redness, pain at the injection site, fever, chills, maybe some body aches. As far as long-term effects, we're still gathering data on those things. I think we know that in the time that we've had, there are very, very few kind of long-term effects with the vaccinations. The other side of that is you have to think it's kind of a risk-benefit analysis. Okay, well, what is the risk of the vaccine versus what is the long-term risk, short-term and long-term risk of getting the COVID infection? And we're seeing a lot of kind of lasting effects of the COVID infection. And I know that Dr. Williams can probably speak, very clearly to that. And also I think Dr. Moser has a comment, but I think it's one of the things that we have to think about is like, well, with the vaccination, with this technology, we have much fewer known long-term side effects. With COVID infection, we have much higher known short-term and long-term side effects. And so I think that we have to balance those things, and we're still gathering information on it.
Has there ever been a known long-term side effect of any vaccine?
Not that I'm aware of, as long as a person does not have an immediate reaction or that kind of thing. I'm not aware of any long-term side effects. But I'm sure that somebody, may have some information.
I'm pretty positive that's actually an accurate statement. Now, there are real possible risks of short-term that can become long-term like side effects in the 6-week course following the vaccination. And there, of course, could be an exception. This could be the first ever documented incidents, because while mRNA technology is very well researched and has been established in the field, it's by far the first broad stroke use of the mRNA technology for this wide scale of a vaccination effort. So
Dr. Williams, what do you think? What are your thoughts about that, short and long-term side effects of vaccines in general, and then also this particular vaccine?
So exactly what you said, and just like anything we do in life, right? You whether you realize it or not, you're weighing risk and benefits of everything you do, right? You cross the street, you're weighing a risk and benefit of getting hit by a car. You are. You just don't realize that you're doing it because it's something that's programmed and very natural. When we as human beings are faced with decisions that are that invoke fear in us, we tend to push back and say, oh my gosh, this is something that's very new and I can't trust it, because it creates a lot of fear and anxiety in you. About the vaccine, because we just have the vaccine, this is going to be 1 year now, December, right? So we really don't know what the quote long-term effects of it are going to be. But like with other vaccines, I don't think there will be a lot of long-term negative consequences to it. I can speak to that if you do get COVID, there will be there will be consequences, because I've seen it. And as a hospital medicine doctor, this entire year caring for patients, and I'm talking about healthy 30-something-year-olds that I've seen die, healthy 50-something-year-olds, people in their 90s with other medical conditions, people in their 20s who are in my hospital for weeks before we can get them out. It's heartbreaking, and it's very upsetting as a doctor, as a physician, as a healer, because I encourage everybody, listen, there's something out there, a vaccine that can prevent you from contracting this. And the way I look at it, especially when I think of my daughter, her name is Kira Lennox. When I think of her, I think of, yeah, you can bring her. I think of cocooning. And so this is my new baby. She's 2 weeks old. She's very healthy. She's very, very healthy. And she and I got the vaccine when I was 5 weeks pregnant, and I was terrified. I was absolutely terrified because, it's something that you don't know. I might get tearful. And you think of a decision as a mother. And I'm a first-time mom, and I didn't have the information that you all have about the safety of that vaccine. So I had to make a decision based on as much truth as I can find and not based in fear. Because to make a decision based in fear, it would just consume me. I had to do my own research. I had to go to the CDC website. I had to talk to pulmonary doctors that I knew. I had to look at my patient population. I had to really do the footwork. And I had to have faith that the decision I was making in my heart was the right decision, because as a hospital medicine doctor, my chances of being pregnant and caring for these patients and contracting it myself was very, very high. In the first week of January, a few weeks after I got the vaccine, my husband got COVID somehow. I mean, he was home. I don't know. And I don't know how it happened, in the same living space. And I did not get it. By the universe, by the grace of God, by whatever you want to call it, destiny, I did not get it. And I got tested multiple times to make sure that I was negative. But when you think about risk and benefits of the vaccine, I say you have to think about risk and benefits of not contracting the virus versus contracting the virus.
Right.
The risk of a pregnant person contracting the virus is very high. You will be sicker than other people. Even if you're young and healthy and 25 years old, no medical problem, you will be sick. Your chances of being admitted to the ICU are going to be higher. Your chances of being intubated and being put on a mechanical ventilator while you're pregnant are going to be higher. Your chances of having medications that, technically don't correlate and correspond with somebody who's pregnant and may put a risk to your baby to save your life are going to be higher. So absolutely. I say, think about it like that. The long-term consequences that we're seeing, and I could say long-term now because it's almost the end of the year. Thank you, honey. My husband is wonderful. Is you're seeing patients, even if they recover, no matter their age, no matter if they had lung issues before or not, you're seeing them develop chronic lung disease. You're seeing them have breathing problems. You're seeing 30-year-olds going home on oxygen. So I say, think of that. Think of that as a potential reality, and then, put it to the 10th power if you're pregnant. And considering that your life and the life of your baby is going to be something that has to be discussed on a multidisciplinary team, where a decision may have to be made to save your life and not your baby's life.
Right.
So,
and can I interject there? This is like, you set it up so beautifully that, you see the people who are young and healthy. And the difficulty is that, I consider myself young and healthy. Yeah. Right.
Yeah, same.
And so, but we feel invincible. We feel like nothing can touch us. And, that's something that's happening over there, but it's not going to come here. And just like you said, it was in your house. Your husband was ill. You know what I mean? It's where you work. We all have heard about the first line workers, you know, in New York, and that being kind of the epicenter, and that whole, just how many of them got sick and died just from caring for patients.
Yeah, I'm from New York City, and I trained in New York City. I trained in New York Presbyterian, and all my friends were on a text message chain, and it was so devastating to hear their experience, and just it was like they were treading water and gasping for air every second to just try and survive and try to save their patients.
And now we have something that can protect us, that you got, and it protected you, you know, from your exposure. So that's amazing. That's an amazing kind of first line story. But when you speak about, you know, pregnant patients and the increased risk of just severe morbidity and mortality, it's real, guys. It's real. So I always tell people, pregnancy is like a physiologic stress test. It is hard on your body. Your heart is working harder, your lungs are working harder, your kidneys are working harder. And then add on top of that a respiratory illness, and not just any respiratory illness, a really, really aggressive and ugly respiratory illness. And we know that pregnant patients in general do not do as well with respiratory issues, with flu, with, you know, any sort of kind of invasive respiratory infection. And so whenever we talk about, you know, it's different from being, you know, young, healthy, unpregnant. And then once you're pregnant, your body does not respond the same way. You have much less reserve, and you can get sicker much, much faster. For that reason, I think it's important for pregnant women to consider getting vaccinated to prevent that from happening. And like you said, when people are admitted to the ICU, we're having really difficult conversations, okay? You know, you're getting high flow nasal cannula, which is basically oxygen that's being rocketed up your nose and into your lungs, or you're having a mask that's blowing air into your lungs to open it up, or you're having to be put to sleep and intubated with a breathing tube. There are times when we're talking about something called ECMO, where there are pregnant ladies whose lungs are so severely damaged that they have to have a machine attached to them that basically oxygenates their blood. And this is like a last-ditch effort, guys. This is not something that you want to be going through, pregnant or not. Then we're having to determine, okay, how far along is this patient? Is it better for us to deliver them? Are we going to have to deliver them at 29 weeks because their lungs are not able to accommodate them and the baby? Sometimes delivery helps with mom's recovery, sometimes it doesn't. And there are patients that we have delivered and we lost mom. We have had patients that we delivered and they got better. We've had patients who have been in the hospital for weeks and weeks and weeks and weeks because they're just not well enough to go home. And so this is my lived experience. This is the day-to-day, you know, this is what we're going through. And we're also having to deal with patients that really should be in the ICU, and we don't have space. Like, we don't have anywhere to put them. And so we're having to hold patients in facilities where they're not equipped to take care of them. We're having to move other patients out of the ICU sooner than they should because we have sicker COVID patients coming in. So there's a lot of strain on the healthcare system. There's a lot of strain on your body as a pregnant woman if you were to get COVID. And so these are things that a lot of times you don't get a glimpse into kind of from the outside. And we just wanted to give you an idea of what the healthcare system, or what we're trying to prevent from happening, because we want you to have a healthy pregnancy. We want you to have a healthy baby and to be well to take care of them.
And that was a very passionate and very appropriate and well put, Dr. Porsche. Let's divert now, because I know well, that is real and 100% truth. I don't want to alienate some in regards to being called fear-mongering, even though it's real and it's just frustrating. but let's say for the women that have decided that they want to get the vaccine between Pfizer, Moderna, J&J, those are the three available and offered in the US as we speak. What has the most data in regards to pregnancy? What are different pros, cons between those three?
Yeah, so we know the most about Pfizer and Moderna because they came out first. We have,
and I would argue probably more about Pfizer as well because of the data in Israel.
Yes, probably. And our recommendation have been to get the vaccine that you have access to, but if most people have access to Pfizer or Moderna. The Johnson & Johnson, there have been some reports about thrombosis or increased risk of clotting with that vaccine, but so most people are.
Do you know how much that is by chance?
Say that again.
Do you know how much that is?
I do not. It's a very low number. It's very low, but it's just higher than the other two.
Correct. So it's about a 7 in a million chance. To put that in perspective, the birth control pills that I prescribe on a day in, day out basis is a 1 in 3,000. So you're talking multiple folds less. That being said, in pregnancy, it is a pro-clotting state, and immediately postpartum, it's even a slightly more pro-clotting state. So for your average pregnant lady or average postpartum lady, it may weigh a little bit less in the J&J favor. That being said, if you're more concerned about the mRNA vaccine being less researched, the adenovirus vector that the J&J virus platform is on. So the Johnson & Johnson vaccine is based on a very old, dead vaccine basis. That's the same vaccine that they gave infants for RSV and Ebola. So the safety behind that platform is more established in that way. It does have a little bit less efficacy in regards to it. It is only 1 shot versus the other being 2. It might have a little bit of a quicker upswing in the vaccination, but with a slight increased risk of blood clots in regards to that one. So that's what I would say in regards to the J&J pro and con. Sorry, I apologize.
That's awesome. No, that's great.
That's a fantastic way of putting it into perspective.
In regards to the Pfizer and the Moderna, I used to be leaning most of my patients, honestly, for the Pfizer, mainly because of 1, slightly higher numbers in regards to the safety, 2, a slightly less second vaccine side effect profile, specifically for my first trimester patients that are worried about the low risk but real risk of fever. And while the pregnancy miscarriage rate, according to the VSafe and the VAERS system, has been equal or less than baseline, it still, we know that at least a long-term sustained fever has been correlated with a slight increased risk of miscarriage or negative pregnancy outcomes.
And I think, and just to clarify, just to make sure people understand, you can get the vaccine in the first trimester.
Oh, yes.
Williams got it at 5 weeks.
Yeah.
There is no increase. There has been no documented increased risk of miscarriage. So the baseline miscarriage risk is 11 to 16%. In the VSafe study, it was about 13%. And so that is exactly what we would expect as far as first trimester pregnancy loss, vaccine or not vaccinated. Yeah. So just to make sure that's clear. And then as far as fever during pregnancy, we're really talking about super high sustained fevers being problematic. And Tylenol is safe to take in pregnancy, and Tylenol is an antipyretic, so that decreases fevers. And so that's what I always recommend to my patients, is that sometimes you might get a fever, you get body aches. Tylenol is a great thing to take, and as long as that temperature kind of comes down or stays down, then you're good.
Absolutely. And I would welcome Dr. Williams to correct me on this. My understanding was that women should not pre-treat with Tylenol, that can sedate the immune response. But 4 hours after the vaccine, you can preemptively take a Tylenol, and that has been shown not to decrease the efficacy of the vaccination, but can possibly prevent a fever from occurring. Is that accurate, William?
So
Dr. Williams?
I don't know about the efficacy, but
Okay.
I've told all my patients and my colleagues in adult medicine, whether you're family medicine, primary care, or hospital medicine, it really doesn't matter. We give vaccines in the hospital now. We give the first dose, and a lot of patients say, "Oh, well, can you give me something beforehand?" And I tell them, actually, no. One, if you're going to have a response that is uncomfortable, I want to know you're having it. That's number one. I don't want to mask something that can happen. We also don't want medications on board that, again, this is all new to us. We don't want you to start taking medications and it's actually that medication is causing something else to happen. It has nothing to do with the vaccine. So that's why we say don't take anything beforehand. This is not like I'm going to go get a wax and I need to take my ibuprofen so my pain is less and, and I don't have as much inflammation. This is not what this is. We want you to be able to come in as yourself with no other medications in your system that are acute, meaning you take your chronic medications, if you have a thyroid issue or something like that, but we don't want you taking any of those medications. Now, a few hours after, yes, if you start feeling your body's hurting or you're having a fever, or you remember, take your temperature. It's always important to take the temperature and look at the number. Don't just say, I have a fever. No, take your temperature. Please use a thermometer, because you may just be feeling warm, but your temperature is not at the fever level. And in the hospital, I consider anything above 38 Celsius or 100.4 Fahrenheit to be a fever. But even then, so you don't always have to take something to get that down. Sometimes just, taking a cool bath, using some ice packs, things like that will bring your fever right down. We're a society of, we want to take a pill to make it better, when, Mother Nature sometimes just has what we need in the form of a cool pack or something like that. But yes, definitely a few hours later, if you feel like you need to take a Tylenol, definitely take it, but also talk to your doctor about it before you do it. That's what your doctors are there for. You could go to your local pharmacy and get your vaccine, and they usually give you a number to call, but your primary care doctor is your best friend. Your OB is your best friend, right? And for this patient population that we're talking to right now, ask them. They have the answer. They'll be the one, because remember, you want to talk to somebody who best knows you, best knows your care, best knows your history. So that's the person that, even myself, I asked my OB, can I take a Tylenol after my second shot because I was having a fever and I was having, but I was like, yeah, sure. Yeah, take it like this. This is how I'd recommend it. If your fever doesn't break by this time, let me know. And I may want you to come in, right? But that's what we're here for. And I know it sounded scary, the things we were saying before, before Dr. Moser came in, I wanted to say that nothing we're saying is to scare you. Everything we're saying is to inform and educate you, because knowledge is power. The more knowledge we can give you, the more informed decision you can make. And I'm going to say this, and I said this to myself, and my mom said this to me in the past when I've, had to deal with decisions and things like that. There is no wrong decision that you're going to make for yourself if you make it with as much information as you can gather. The decision to, and the same thing for your unborn child or your born child that you have now. There's no decision that if you make it with as much conviction to know what facts are and truth is, that's going to be wrong for you.
And I 100% agree with that statement. While we have more of a science background, you know your body, and it's your baby, your future baby. So it has to be, as long as it's a well-informed decision, our goal is to give you as many tools in your toolbox and take as best care of you as we possibly can. The rest is all you. And I originally had kind of leaned most of my patients towards the Pfizer, like I was saying, for that reason. However, I'm a little bit more up in the air just because of the more recent data of the antibody responses being stronger with the Moderna, specifically in response to the Delta variant. Who knows with the mu variant? I'm not certain. Moderna does come with an additional, like a slight increased risk of fever and body aches and chills and the local effects after the second vaccines, most specifically. But now I'm a little bit more on the fence between the two mRNA vaccinations. What are your thoughts?
I think between Pfizer and Moderna, whatever, for my patients, whatever you have access to. There are some patients that, have to get it through the military, or they have to get it, this is the clinic that's by their house. Then I say, whichever one you have access to is going to help to protect you better than not having the vaccine at all.
I agree. And I tell adult patients the same thing. Whatever you have access to in your community, or from your doctor's office, or from your hospital, if they're giving vaccines, is the vaccine that I would say, go with that one. Follow up to whenever your second dose should be. Don't miss that. It's very, very important. And being on the fence between two vaccines that I have seen in my own personal journey, prevent infection in me, but also in my patients that I've seen, where somebody's gotten it, and in the household other people were vaccinated and they didn't get it. And it's just important. And I read this term cocooning the other day, and I thought it was so cool for babies. I never heard it before, that when I get a vaccine for something, right? Not even COVID, right? I get a vaccine against chickenpox or tetanus or something like that. And everybody in my inner circle gets it. And people in their inner circle get it. And can you imagine like a circle forming and putting the baby at the center? What did we just do for that baby? We just protected that baby. And every life is important. The life of my child is important, but that my child's life is no more important than everybody else's, because we all share this world together. We share this community together, and it's our shared human experience and our compassion and empathy for each other that we understand why getting vaccinated is important. Yes, it's fearful, because when you have another life grown in you, as I did two weeks ago, oh my gosh, everything you do, should I eat this? Should I do that? A food becomes oh my gosh, is that going to hurt the baby? So I very freshly understand that fear. But going beyond the fear, as I said before, going beyond the fear and arming yourself with knowledge and facts, that's going to help you make your decision, whatever that decision is. And I want everyone to know, whatever you decide, we as physicians, as doctors, as healers, we're going to support you. Like we're not here to say you should do one thing or the other. Yes, we recommend vaccination, but I always tell my patients, I'm still going to care for you. I'm still going to love you. I'm still going to support you in the best way that I know how, because your life is important to me. And understanding that that is human compassion. That is what that means. That's empathy, and that's caring without judgment. And that's what we all of the three of us here as physicians. And I'm very honored to be on this panel with these beautiful, intelligent women, who are reaching out to our respective communities. That whatever you decide, we're going to support you, but we just want you to be healthy. We want, like you said, healthy moms, healthy babies, but whatever we can do to protect our children is always going to come first. And I think that when you look at it that way, the matter of perspective really changes, and that needle just may move in one direction or the other.
That was awesome. Thank you so much. I wanted to jump in and share a couple of questions that we've received from folks. Gosh, Dr. Williams, you talk about that instinct to like be hyper vigilant and to protect, and that starts so early. And for most people, it starts before you're even pregnant. Can you speak to concerns about fertility? We have people in the comments sharing how they're going through IVF. Maybe they're 40 years old and trying to become pregnant. And there's a lot of fear around vaccination in that time and what that could mean. Can you talk through any impact that would have on fertility?
So the available data shows that there is not any effect of the vaccine on fertility. It should not change anyone's cycles. It should not change the ability to become pregnant. So we are recommending that, anyone who is thinking about becoming pregnant, go ahead and get the vaccine. But there is not any available evidence that it affects cycles or fertility.
I was flabbergasted because I still remember the first day I walked up into labor and delivery, and it was when the theory that it impacted infertility had first come out, and I guess it had not met my news update for the morning. And I had 4 labor and delivery room nurses all ask me about how it was going to impact their fertility. And it just, science-wise, the initial claim that it did made 0 sense. This was when the trials had just released their data. They hadn't done like egg reserve studies. They hadn't there hadn't been 9 months to see about impact for future pregnancies, because the same number of people became, none of the trial included pregnant ladies on purpose, which is a whole separate debate, because a lot of OBGYNs would argue that it's a disservice to the pregnant population, and our future mortality and morbidity in the US comes in part, in a lot of other parts as well, but from lack of actual good scientific data, because no research is basically allows for pregnant ladies to be included. So they were to be included, but incidental pregnancies happened equally within the vaccination, well, slightly higher in the vaccination group than in the non-vaccinated group. So at least in the trial data, there was no impact on fertility because they accidentally conceived when they weren't supposed to. And then in regards to, they have done short-term, I think, semen analysis studies for male fertility, and that has not borne out to have any impact on the semen analysis. In regards to impacting cycles, I'm always a little bit more cautious, because any stressor to the body, will it be a natural reaction to the vaccine, getting COVID, getting a loved one that gets sick, any biological stressor can slightly impact a menstrual cycle. So I'm not sure whether I can say that the vaccine might not impact someone's period, but to say it impacts their fertility, to our current knowledge, one, I don't see how it would scientifically possibly impact the fertility of any pregnant woman, because the inactive ingredients are, sorry for donkey, are common enough inactive ingredients of other vaccines that don't impact fertility. I can't see the mRNA would be degraded before it ever impacted the egg, the endometrial lining, or the uterus lining, sorry, the tubes, nothing to that regard. So to our current knowledge, we've never seen an impact. To our actual knowledge on the semen analysis, it has not been shown, and I don't see how it would either.
Got it. Great. Thank you for that answer. We've also seen quite a few questions about boosters. So with boosters in particular, there's questions about if someone, I guess, had their, first round of vaccinations while pregnant, would they expect their immunity to lower or even disappear after their pregnancy? And should they be more proactive about boosters, or what other thoughts do you have on that?
So I don't think getting your initial vaccination during pregnancy or outside of pregnancy should affect the longevity of your antibodies. And so your booster timing and efficacy should be based on how long ago you had your first set of shots.
Got it.
And the conversation of boosters probably is beyond our current conversation today. It probably centers more on a globalistic versus nationalistic kind of ideology. And I don't know whether it's as centered to today's conversation.
Sure. And we've also seen a couple other questions about vaccination before pregnancy. Are there benefits to your baby if you were already vaccinated before you became pregnant?
So you should still be able to pass antibodies to the baby as long as they're circulating in your blood. So as long as you maintain immunity, those IgG, those go antibodies will pass through the placenta, and be present for your baby, offering passive immunity.
Great. There's also a question about getting the vaccination in your first trimester in particular, because there's obviously a little more nervousness about a pregnancy at that point, and blood clots might be more likely. Maybe it's your first pregnancy and that's scary. So those are some of the comments that people have shared. But any thoughts on your first trimester for getting a vaccine?
So vaccination is still safe in the first trimester. I think we talked about this a little bit. We touched on it. A lot of people are afraid about the fevers and the side effects and things like that. But there has not been shown any increased risk of pregnancy loss with vaccination in the first trimester. So we recommend that people get it before pregnancy, but also as soon as they are able to during pregnancy.
It really plays to that risk benefit, when you're thinking about that, what we talked about before, just very quickly how I explained COVID to patients in my hospital and in the community. It's like a forest fire happened in your lungs and everything got burnt. That is the simplest, and it is not my partner, Maggie Williams. She's the one who explained it to a patient once, and I was in the room and I was like, that's a great analogy. It is a forest fire that happens in your lungs, and the fire has already happened. So by the time they get to me, they're very, very sick. So whenever I think of that, I have to explain to my patients in the hospital that I don't have a cure for COVID. I don't treat COVID. I treat the aftermath of the fire. I treat what happens afterwards. And I I've found that they respond really well to that analogy because they can understand and see, and if you've ever had a fire in your house, I have when I was in high school, it is devastating. Is a devastating thing that happens once the fire is done. You have to deal with the water damage, the smoke damage, the structural damage, and that's what it does. Is a structural damage that happens, and everything we give is to help support a person and their lungs and their breathing, and even sometimes their other organ systems that may become involved, their liver, their kidney, the strain on their heart, depending on what their heart was like before. So when I think of when we talk about, should I get in the first trimester, I don't want to have a fever. Well, I don't want you to have COVID either, because that's going to be catastrophic for some people. And so as preventative as we can be, as much as I love seeing people, I'd love to not see you in the hospital. I want to see you like in the grocery store or in Marshall's or something like that. So just putting it into that, I call it a simplistic way of thinking about it, but that's how I think about it.
Yeah, that's great. We're right at 7 and I can't believe it. This has flown by. Would you each like to share maybe a closing thought or important takeaway that you want to share with us before we wrap up here?
Sure. I just want to let all my patients and community loved ones just know that I truly just want a healthy mom and healthy baby. And I don't mean to ever fearmonger. I just want to tell you the facts. And if I want to help to hopefully reestablish some of the trust that I think having this become more of a politicized discussion has hurt some of my rapport. And I find that also a true shame. And so anything that I can do to help regain and just focus on as much or as little as we do have knowledge of, I would love to.
Absolutely. I mean, I think you said it very well, Dr. Moser. I want just to speak to the people who are watching in the community and that have questions. And we know deep down in our hearts that everyone's questions are coming from a place of deep love and concern for yourself, for your baby, for your children, for your loved ones. Also, please know that all of the information that we give comes from a deep love and concern for our community and for the people that we care for. We definitely, are not out for any agenda. We're not out to harm anyone or to offer information because of any sort of personal benefit. We want you to be safe. We want our communities to be safe. We want you to have a enjoyable and thriving pregnancy, not one that's riddled with fear. And so, like was said before, like Dr. Williams said, if you have more questions, talk to your provider, talk to someone who you know and you trust, and they can give you the best information for you. And they're going to have time to talk to you, and they're going to know your history and know your situation. So definitely reach out, use this as a springboard, use this like, hey, I heard this, some information on this webinar. What do you think about this? And talk to them about that, because I think that's going to help you really get the best information. Thank you for coming. Thank you for watching. Thank you for participating and, giving, questions. We want to give you best information that we can. And we're really, really happy to spend this time with you.
And I'll just say, first of all, thank you, Dr. Moser and Dr. Porsche, and everyone who joined in. Just you taking the time to just come to this webinar just shows that you're interested in just asking questions and finding out information. Exactly to the points that have already been made. And I will say this, your obstetrician, your OB is getting paid to keep you healthy. Think about it that way, to keep you and baby as healthy as you can through 40 weeks of pregnancy. That is their job. That's a cool job. Their job is to make sure that moms and babies are as healthy as they can be and that no harm comes to them. So if your doctor, your OB is telling you, these OBs are telling you that this is something they recommend, they're not saying it in a flighty way. They're saying it because it's something that they strongly believe in. And I think that that's really, really important. I asked my OB before I even got the vaccine because I didn't know what to do and I wanted to make the right decision. And, you know, and I can think I could say this for all of us knowing you all on this webinar is, you know, medicine is not an obligation to us. It is a calling. It is not a job. It is not something we do. I love what I do. I would do what I do for free. Don't tell my bosses that, but I would. I love what I do. And it is a calling that we have. And it's our position to have a responsibility for the health of our communities, you know, and it's through our caring, our compassion, and through respectful and empathic conversations like this that is the only way that we're going to create dialogue, because our goal is to advocate for all human life and to have that shared responsibility, not only to our communities, to our states, our countries, but to the world. That to be a part of that is something so much greater than anything else that we'll probably experience in life, to have this connection, you know. So I advocate for all human life, you know, my life, your life, the life of a baby being, you know, cooked in the oven right now, baby being born today, baby who's already been born. So understanding that we come to you all with our hearts, you know, on our sleeve, and talking as genuinely and sharing as honestly and compassionately as we can. And I hope that the people listening in were able to really take something away and something beneficial to your own personal lived experience. But thank you all.
Thank you so much. As a reminder for everyone attending, you can email Sentara-events@sentara.com with any questions that you have following the event. We want to make sure that they all get answered. A recording of this webinar will be sent to your inbox following the event, and it'll be available publicly if there's any friends or family that you want to share it with. And just a reminder that if you need more information or you're ready to learn what's next when you're ready to be vaccinated, you can visit vaxupva.com or vaxupnc.com. So thanks everyone for joining us, and have a great rest of your day.
Thank you.
Thank you.
Thank you.